consent.
Number 26.
Senator Black.
Merci, Madame la Présidente.
Thank you, Madam Speaker.
I rise today to speak to my colleague, Senator Sharon Burey's important inquiry on mental health, substance abuse, and addictions parity. As a doctor and pediatrician, her wealth of knowledge has brought immeasurable insight to our discussions in this chamber and in the Agricultural Committee, and I would like to thank her for her hard work, her interventions, and her insights. Colleagues, mental health is a critical issue and is a conversation that touches every one of us, whether directly or indirectly, and is long overdue. Like most of my interventions in this chamber, I would like to approach this inquiry from the perspective of the stewards of our land, our farmers and farm families. Mental health in the agricultural community is an issue that deserves special attention, and I believe it's a reflection of the broader societal challenges we face regarding mental health and addiction. We know that mental health challenges and substance abuse are deeply intertwined, affecting Canadians from all walks of life. But when we look at mental health struggles within our agricultural communities, we see a unique and often underrepresented set of challenges. Farming is not just an occupation, it's a way of life, one that involves long hours, financial uncertainty, and instability and isolation. These factors create a mental health landscape that is distinct from other professions. Colleagues, let me explain this further. In Ontario, farmers, agricultural workers, and their families often work in socially isolated and remote environments. This distance from urban centres, combined with our inherent cultural and societal pressures to be resilient and self-sufficient, means that many in the agricultural sector may feel that they have to tough it out rather than seek help. The stigma around mental health can even be stronger in these communities, and we must address it head on. This problem is compounded by the fact that mental health resources are often inaccessible due to the remote and rural locations. Accessing mental health services often requires traveling long distances, which is not always feasible, especially during busy farming seasons. There are many industry-led initiatives offering mental health wellness tools specifically geared towards farmers and those in the agricultural sectors and their unique needs. For example, Agricultural Wellness Ontario is doing tremendous work through their suite of free programs designed specifically to support the mental health and well-being of Ontario's agricultural community. Managed by the Canadian Mental Health Association's Ontario Division in partnership with agricultural stakeholders, this program offers crucial services such as 24/7 counselling, peer support, and mental health education tailored to the unique needs of farmers. Another example of industry initiatives would be the many programs and supports offered through Farm Credit Canada, either offered through or supported by Farm Credit Canada. They are doing great work for the industry and provide wonderful support for those seeking help. Colleagues, the availability of these types of services is a significant step forward, but it is only one part of the solution. We must do more to expand these kinds of services and initiatives, not only here in Ontario, but across the country. We need federal, national programs that recognize the specific challenges faced by farmers and that offer targeted support to meet their needs where they are, whether they are on farm, at home, or within their communities. Keeping in mind the lack of access to reliable broadband internet in many of these rural and remote communities is also a huge barrier to accessing adequate health care, including mental health services. Colleagues, the reality is that many farmers experience what has been termed farmer syndrome, a manifestation of physical fatigue, mental tension, and burnout. This syndrome is often a direct consequence of the demanding and relentless nature of farming life. There are no 9-to-5 workdays in agriculture. The effect of farmer syndrome can be severe, leading to a host of physical and mental health issues, including depression, anxiety, heart problems, and even substance abuse, such as use as a coping mechanism. Research from the University of Guelph and other academic institutions has demonstrated that farmers are particularly vulnerable to mental health issues. In fact, a national survey on farmer mental health conducted between 2015 and 2016 found that Canadian farmers face significantly higher levels of stress, anxiety, depression, and burnout than the general population. The survey also revealed that many farmers were less likely to seek help for these issues, often because they felt they had to prioritize their work over their well-being, or they feared being judged by their peers, a common stigma placed on those that request help. Support programs geared towards farmers' mental health are lifelines for them, providing training, education, and support in ways that resonate with their unique experiences. However, as beneficial as these programs are, they are not enough, as I've said. We still face significant barriers to mental health care in rural and remote areas. Cost, stigma, and geography continue to prevent many farmers from accessing the help they need. Colleagues, we must all work together to eliminate barriers and ensure that every Canadian, no matter where they live, work, or play, has access to the mental health support services they need. As someone who is deeply invested in the well-being of farmers and farm families, I've seen firsthand how essential our farmers are to the economic and social fabric of this country. They feed our nation, they care for our land, and they contribute to the sustainability of our communities and of Canada. However, we must remember that their mental health is as important to the sustainability of Canadian agriculture as is soil health, crop yields, or livestock management. When farmers are struggling with their mental health, it affects not only their well-being, but also their ability to care for their farms, their families, and their communities. As we look to the future of Canadian agriculture, we must ensure that access to viable and stable mental health supports must be a cornerstone of all agricultural policies. This means integrating mental health services into the broader framework of agricultural support programs, recognizing that the health of our farmers is inextricably linked to the health of our agricultural sector as a whole. Of course, the challenges we face are not limited to the agricultural community. Across Canada, we are seeing rising rates of anxiety, depression, and substance abuse in all sectors. The mental health crisis that has grown in the wake of the COVID-19 pandemic has only deepened the existing cracks in our healthcare system, exposing the urgent need for reform. In a recent report, the House of Commons Standing Committee on Agriculture and Agri-Food emphasized the need for urgent action, not just within agriculture, but across all industries and sectors. There is no excuse for mental health resources to not be accessible or underfunded when the need is so clear. Everyone, including government, industry, the private sector, and everyday Canadians, must take bold steps to address this crisis, starting by ensuring that mental health and addiction treatment are treated with the same urgency and importance as physical health care. As we move forward, colleagues, we must take meaningful steps to achieve true parity for mental health and addiction treatment in Canada. This means ensuring that mental health services are fully integrated into our healthcare systems and they are accessible to all Canadians, regardless of where they work or live or what profession they work in. As Senator Burey alluded, it means reducing the stigma associated with seeking help and increasing funding for mental health and addiction programs across all sectors of society. We cannot allow mental health to be treated as a secondary issue. The well-being of our citizens, whether they are farmers, healthcare workers, or students, or your local cashier at the grocery store, depends on our willingness to recognize mental health as an integral part of our overall health. In conclusion, colleagues, I want to encourage all of us in the chamber to consider speaking to Senator Burey's inquiry and to continue advocating for policies that recognize the importance of mental health parity. As we seek to address the complex issues of mental health, substance abuse, and addiction in this country, we must ensure that no Canadian is left behind. We owe it to our farmers, our families, and our communities to take action now. Thank you. Merci. Megwich.
Senator Burey? Senator Burey.
Senator Black, I want to thank you so much for your leadership on the Agricultural Committee and for highlighting the needs of farmers and of rural Canadians, and especially related to mental health. As you know, everyone, there is no health without mental health. I wanted to ask you a question, and you alluded to your very comprehensive speech about the productivity, food insecurity when farmers suffer mental health challenges. Can you speak a little bit more about that?
Thank you.
Senator Black.
Thank you, colleague. I will just expand it a touch. Certainly, if a producer, a farmer's mental health is impacted, everything within that farming operation is impacted, whether it be family interactions and relationships, but also how they tend to deal with what they're working with, dealing with livestock, dealing with growing in the land. It just impacts everything. As I mentioned, it's not a 9-to-5 job. We cannot get away from it. We are there. Farmers are there 24/7, 365 days of the year.
Senator